We are going to have a little chat about 12 things that I found out about menopause. Oh my goodness. And I'm not talking about all the things that everybody knows about. All right, I had to move and make myself more comfortable because you know how it is with this time of life. Body odors. I never had an issue with body odor until recently when I was wondering what on earth stank, and it was my armpits. You can let me know if this happened to you, right? But I got a reason for this. Apparently, the hormonal shifts in menopause alter the activity of apocrine sweat glands, and that leads to the changes in body odor. Yay! The specific hormonal changes, meaning estrogen decreasing, can impact on the types of bacteria on the skin, contributing to the distinct scent associated with menopausal body odor. I had no idea that this was a thing. I wish it wasn't. Voice changes. Right. So bit by bit, I found that I'm clearing my throat more and all of that. And partly that is a thing because the vocal cord changes in menopause are intricately linked to hormonal fluctuations, particularly the decline in estrogen. Estrogen receptors in the vocal cords play a role in maintaining tissue elasticity. As estrogen decreases, these tissues undergo changes impacting the pitch and quality of the voice. Wonderful. So some of us have higher pitches, some of us go lower. And we also clear our voices a lot more because when it comes to dryness and all of that, guess what causes that? Anyway, let me proceed. Allergies. So if you have asthma like I do, your asthma gets a bit more complicated and you may have to change your medication. I have had to change my medication. Anyway, menopausal immune system modulation can lead to the development or exacerbation of allergies, apparently. Immunoglobulin E, or IgE levels, which are responsible for allergic responses, may be influenced by hormonal changes, i.e. lack of estrogen. The body's immune responses become more reactive, unveiling new or heightened sensitivities to allergens. And then, of course, because of the same hormonal changes and the fluctuation of how we get more dry skin, which is going to come up, by the way, that affects your mucosa membranes in your nose and all of that too, and it further enhances the susceptibility to allergens. All right, facial growth. Oh my goodness, facial growth. I never was a person that had hair. Who tell me to start feeling sideburnage coming on here? That never used to be a thing on both sides. And recently I found out it was coming down here as well. Let me know if you got this, right? But it's apparently something called Hirsutism. And Hirsutism is also what some people have with PCOS and other medical situations that cause excessive hair growth. But this is regarding the growth of coarse facial hair in women during menopause. Increased levels of androgens, often in relation to a decline in estrogen, can stimulate hair follicles in the face, leading to the surprising emergence of facial hair. I am awaiting the chin hairs. Next thing, dental health impact. Now, let me tell you a quick one, right? I turned 50 a couple years ago. 6 months in, who told me to eat hummus? And then one of my molars decided to crack in half on hummus. I personally didn't even put 2 and 2 together to figure out that this actually has something to do with my lack of estrogen. Had to get a whole set of stuff done that I had never done before because my teeth were pretty okay. Anyway, menopausal changes in estrogen levels can affect bone density. Makes sense. But you don't think about that, you're thinking about arthritis. This apparently includes the jawbone. This can contribute to gum problems and periodontal issues. Understanding the hormonal impact on oral health emphasizes the importance of regular dental care during menopause. That is something that I've definitely upped the ante on. I suggest you do this too. Libido variations. But this is a tricky one though. The interplay of the psychological, so we're talking about the psychological thing now, and we're not talking about how way back in the day, like how I did in one of my other videos, how they used to say that women are now hysterical and have hysterics, and we ain't talking about this. We're just talking about the normal psychological impact of not having periods anymore, and the physical factors as well during menopause leads to diverse changes in libido. Hormonal fluctuations influence the neurotransmitters and the blood flow, and that impacts desire. And then there are factors such as stress, relationship dynamics, and overall health, which contribute to the nuanced variations in menopausal libido. Some of us have in the back of our mind, or probably in the front of our mind, that we're not having kids anymore. We don't have to worry about periods, so therefore we can do the thing. However, regardless of what you do or don't do, please keep yourself safe, because no matter what you do, you're still prone to getting things. So here ends my case. Blood pressure fluctuations. Now, I have always had an issue with blood pressure problems. It runs in my family. I've had issues with the preeclampsia. See the video here. This just is part of my flow. It got worse. Lovely. When you get 200 and something over 100 and something, you know you're bad. Anyway, menopausal hormonal changes affect blood vessels, fluid balance, and the cardiovascular system. This complexity leads to unexpected fluctuations in blood pressure. As for me, as soon as I had my hysterectomy, and I know it's not completely to do with menopause, even though that started. As soon as I had my hysterectomy, that evening I almost had a stroke, but I move on. Heightened sensitivity to smells. Let me know if when you smell things nowadays, right, if you feel as if you're gonna throw up, or if when you smell things nowadays you are wondering if other people smelling these things, because all of a sudden you can smell everything in sight, and how annoying that is. Anyway, hormonal changes can influence the olfactory system, which is all up here, impacting the perception of smells. Estrogen receptors in the nasal cavity respond to hormonal fluctuations, leading to the heightened sensitivity. Wonderful. This sensory alteration can affect daily experiences with various scents. Let me know if this affects you, please. It definitely affects me. Moving on. Motion sickness susceptibility. My vertigo has gotten worse. And we know how vertigo goes, right? It can happen all of a sudden. And if you're walking, you feel as if you're going to walk into the road. I feel like that sometimes. Menopausal impacts on the vestibular system, responsible for the balance and spatial orientation, so this is like inside your ear and things like that, contribute to increased susceptibility to motion sickness. Changes in estrogen levels may disrupt the delicate balance of the system, resulting in the surprising challenges during activities like car rides and boat trips. All like now I'm sitting down talking to you, and because I am moving my head backwards and forwards, I feel like woozy. For all you people that like drinking coffee, right, and alcohol, this is for you. Estrogen's role in the metabolism of caffeine and alcohol becomes apparent during menopause. As estrogen decreases, the body's response to these substances can change. This includes the variations in sensitivity, tolerance, and overall impact, influencing how women experience these commonly consumed substances. I'm not a big caffeine drinker, neither am I a big alcohol drinker, okay? However, I've realized that as time has gone on, I never could drink wine much. I could drink a rosé, that's fine. But all the other little things like cocktails that you can get in a can and stuff like that, I don't think I can drink them anymore, and they don't really have much alcohol in them. Yeah, I don't like how I feel when I drink these things. Anyway, metabolism of medication. Listen to the irony of this one, right? Isn't it at this stage of our lives when we have to deal with all the other things like the heart and the this and the that and the third and probably some HRT and all that, we have to take the medication, but our body body is now responding differently to the medication? Like, how is that supposed to work? Menopausal changes in enzyme activity, particularly in the liver, affects the metabolism of medications. This can influence drug effectiveness, side effects, and overall therapeutic outcomes. Understanding the hormonal impact on medication metabolism is crucial for managing health during menopause. Now, if we are sick and we take medication and it's not responding differently than how we used to, we have to figure out what medications we can take all over again. That is why it's so important to find the right doctor that can help you with your menopause and visit them quite often, because now we have not the foggiest idea what we are supposed to be doing with our now menopausal body. And finally, we've come to 12. Breast size increases. I never had an issue. Now I'm wearing a 36E. Never in my existence did I think I would ever need a 36E bra. But it is such an interesting way how that happens. Annoying, but listen, the decline in estrogen during menopause affects the composition of breast tissue. Hormonal imbalances lead to changes in fat distribution and glandular tissue, contributing to an increase in breast size for some women. Factors such as genetics, weight fluctuations, and overall hormonal balance influence the extent of this surprising change. What happens, right, when we are going through puberty, adolescence, all of that? Our bodies are getting prepared to have periods, getting prepared to go into the stage of our lives where we're going to be having children if we choose to. Our boobs grow and the milk ducts, come into play and all of that. So the milk ducts are always there ready and waiting when we have our periods, which is why our boobs tend to hurt and things when we're going through periods. Then what happens when the estrogen decides to disappear is the estrogen that once controlled how the milk ducts work disappears as well, and the milk ducts turn to fat. So you know how it is with our bodies and menopause and how our shape changes and all that. Because of the lack of estrogen, it happens with the chest area as well. So what is in there now is fat and not milk ducts and milk glands. That I think is very interesting. But as for me, I had to get accustomed to the weight.